When you have your breasts augmented or have an implant placed, you have a couple things that you have choice on. One is where the incision is, one is silicone or saline, and one is above or below the muscle. So how do you know if you want your implant above or below the muscle? One of the most important things is your individual anatomy and how much breast tissue you have. If you don't have a lot of breast tissue, which obviously most, if not many, of breast augmentation patients don't have much breast implant or have much breast tissue, then it's probably better to go below the muscle. It's kind of like having a little bit of an insurance policy. It's another layer of tissue that's between the outside world and the implant. So a real thin individual without a lot of tissue, especially in the upper pole or upper portion of the breast, it's going below the muscle will decrease your risk of wrinkling or visibility of the implant itself. One of the common misconceptions is that if you put your implant below the muscle, it's going to hold it up over time. That's a common misconception. The above or below the muscle doesn't hold up the implant. As a matter of fact, the muscle gets cut at the lower border in order for to allow the implant to give some projection to the breast. So the muscle itself does not have any effect on how the breast ages or droops over time. So there are pluses and minuses to above or below the muscle. The negatives of going below the muscle are you have a little bit of what we call animation deformity. So when the pec muscle contracts, your breasts move a little bit. Now, it's a nice cocktail party trick, but there's not really any good reason to flex your pecs. So if you stand in front of the mirror with a subpectoral or a submuscular augmentation and you flex your muscles, your breasts are going to move a little bit. So that's a negative of below the muscle. The positives of below the muscle are less interference with mammography, less risk of capsular contracture, which is hardening of the scar tissue around the implant, making it feel firm or hard, and less wrinkling. So the pluses versus the minuses, you have to just kind of decide for each individual patient. So who would be a good candidate to have their implant above the muscle? I think there are definitely pluses to going above the muscle as well. You don't have the animation deformity, or the implant doesn't move when you flex your pec muscles because the pec muscle is behind the implant. People who are particularly good candidates for above the muscle breast augmentation are someone who has a fair amount of breast tissue. Because what you want to avoid is skinny implant coming out of nowhere or having the implant be visible. So if you've got a little bit of tissue in the upper pole, it's going to hide the implant. So the negatives of going above the muscle would then be in a thin individual, higher risk of wrinkling. There is a little bit higher risk of capsular contracture, and that's one of the reasons why we recommend textured implants when we put the implants below the muscle, because the texturing decreases the risk of capsular contracture when the implant is above the muscle. Another plus of going above the muscle is the surgery doesn't hurt quite as much. So I think that's a good thing for the short term, but really you have to look at the long term and decide even if it hurts a little more to go below the muscle, is it going to be worth it for you in the long run? Because if you're getting your implants in your 20s or your 30s and you live to your 80s, you're going to have these implants for 60 plus years. So it's don't want to get too caught up in the short term, but it does hurt less.